Hello and welcome to another episode of Coffee with Polio Experts. Today we are here with Honorine Mollard Billard from the Polio Eradication Department at the World Health Organization here in Geneva. Honorine, thank you so much for being with us today. So you traveled recently to Lao in Southeast Asia to participate in some polio immunization campaigns. What specifically was your role there?
My role was to support our country colleagues in helping to monitor the campaign as part of a rapid convenience monitoring. And in Lao, it's a 14-day period. Almost 10,000 volunteers and health workers were mobilized to vaccinate more than 460,000 children under the age of 5 years.
Wow, that's very impressive. So during the immunization campaign, what are some of the challenges that you saw? Did you see parents who were refusing vaccination, or tell us?
Well, all partners, vaccinators were fully engaged, from the government leaders to community leaders to vaccinators to partners such as UNICEF and Rotarians, and most importantly to parents and other caregivers. We work closely with UNICEF and CDC colleagues, conducting social mobilization activities, and UNICEF specially developed key tools as flip charts and videos in various local languages to ensure the most impact. So as a result, the parents was not resistant to the vaccination. It was very, very impressive.
Thank you. But the country is in fact polio-free, is it not? Why do they need to run vaccination campaigns, in fact?
Yeah, that's a good question. Polio is a highly infectious disease. And in case of Laos, a new polio outbreak occurred in 2015 and 2016, resulting 11 people being paralyzed for life. And so it's important to prevent such outbreaks, and in the meantime, of course, to provide whatever support is needed by the person living with the disease. So I would like also to talk about the pockets. So the country team conducted a lot of analysis to identify area of population or group populations. There may be pockets and of un or under immunized children, and in such areas that the activities are particularly focused and resources are prioritized to such areas to make sure that really all children are reached.
Okay, fascinating. So even though Lao might have high national vaccination coverage, there's some pockets, as you called them, subnationally, where there's some gaps, and it's that which you aim to fill.
Exactly. The country team is really focused on these pockets because, we can still, sometimes roads are inaccessible or very not easy to access, so it's just to make sure that all communities are reached and do not leave any child.
It sounds very challenging if you talk about roads difficult to access. I guess planning is key for such campaigns?
Planning and as well macro plannings. It's kind of detailed map where we are pointing houses and make sure to do not miss any child and to know how many child is living in this house, and if they are not here, just to come back later and ask the parents to either bring the children to the health workers or also we most of the time came back to the house and give the vaccine as well, the polio vaccine, but can be also other vaccines like a penta or vitamin A doses or...
Okay, so other interventions are given as well?
Yes.
Okay.
That's why this kind of event is really important and has a health universal coverage.
Okay. You mentioned the role of some of the partners, Rotary, UNICEF. What about the government? Did you see, is the government involved and engaged and committed?
Of course. And as WHO, we are very, very proud to help support the governments in these efforts and this amazing work they are doing, supporting with the partners such as UNICEF, Rotary, and CDC, and it's very. I was very, very proud and very impressed about this amazing work.
Oh, it sounds wonderful.
Yes.
Honorine, thank you for sharing your insights. For our audience, do you have any final thoughts that you would like to share?
Well, I would like to encourage all of us working internationally to support the Lao country and keep doing these efforts. Thank you for the coffee.
Thank you, Honorine. Thank you again, and thank you for joining us. And join us again next time on another episode of Coffee with Polio Experts. Thank you.
Thank you.